Hello, today we're going to start our discussion about therapy. But before we do, I wanted to ask you a question from the chapter on psychological disorders. Do you remember the name of that book that you used to diagnose psychiatric disorders in the United States? It has 3 initials and a number. You are right. It's called the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition. I mentioned during our earlier discussion that that is the diagnostic publication that's used in the United States and in some other locations. I believe it's used in Canada. I thought it was used in England, but I did a little more research on that, and apparently in England they use the ICD-10, the International Classification of Diseases, the 10th edition, which is also used in other areas in Europe. I just thought I'd give you that little update. So today we're going to talk about therapy. Basically, there are 2 broad categories of therapy we're going to be considering. One is psychological treatment and the other is biological treatment. And we will be exploring both of these types of therapy in this section. You may remember when we were talking about disorders, we mentioned that the treatment of disorders in the early days was very primitive. This picture from our text reminds us of this, showing in the 18th century in mental hospitals, one being Bedlam Hospital in England. Actually, the wording on that is Bethlehem Hospital. They pronounced it Bedlam Hospital. People would actually go there for entertainment and pay for a ticket in order to be taken on a tour of the hospital where they could look at the patients and laugh at them, make fun of them, as if they were animals in a zoo. I mentioned 2 broad types of therapy we're going to look at are psychological treatment and biological treatment. Psychological treatment is also referred to as psychotherapy. Sometimes you'll see it referred to as counseling. And biomedical treatment includes various approaches, especially the use of medication, but there's some other biological approaches of treatment that are also used that we'll have a chance to take a look at. If you have ever been involved in counseling or therapy before, and you were working with a good therapist, you know what a positive difference it can make in your life to have somebody you trust and have confidence in, to talk with you, to listen to you, and to work together with you to help you get to a better place. It is a very rewarding kind of work to do, and many clients benefit greatly from their experience of involvement in therapy or counseling. For our purposes, we'll be using the words therapy and counseling to mean the same thing. Therapies that we're going to take a look at, psychological therapies, include psychoanalysis and its more modern version called psychodynamic therapy, humanistic therapies, behavior therapies, cognitive therapies, and group and family therapies. One of the things I love about discussing this chapter is that it's very easy for us to make connections between the topics in this chapter and things we've learned about earlier in the semester. And you'll see this very clearly in talking about psychological therapies, and also I think you'll appreciate it when we talk about biomedical therapies as well. Of course, Sigmund Freud is the individual who developed psychoanalysis as a therapy approach. We've already learned some things about him. If you recall, what are the 3 big ideas that are associated with Sigmund Freud that we talked about when we studied personality? One is that we have an unconscious mind. Two is that things that happen early in our lives affect how we turn out later on. And three is that when there's conflict in our unconscious mind that can't get worked out, we end up engaging in defense mechanisms. So the basic aim of psychoanalysis is to make the unconscious conscious, helping the patient or client to gain insight, that is self-understanding, into the origins of their disorder, being able to make connections between their past, their unconscious mind, their thoughts, their feelings, their behavior, and any ongoing problems they may be experiencing. Freud used a variety of techniques to accomplish these goals. One that he's well known for, that we mentioned earlier when we were talking about his personality theory, is free association, where he has the patient lie on a couch and just talk about whatever comes into their mind, and then helps the patient to gain an understanding of the connection between those things that are said during free association and what's going on in their unconscious mind. He also believed in the value of dream interpretation and believed that what's going on in our unconscious mind can become known to us in a symbolic way through our dreams. In fact, he was quoted as saying that dreams are the royal road to the unconscious. Another thing he did was interpret what's called resistance. Resistance is anything a patient may do to avoid dealing with the important issues in their life. Freud would say this resistance comes from an unconscious place. It can include a lot of different behaviors on the part of the patient, including things like changing the subject, using humor, trying to redirect the questions to the therapist, waiting until the end of a session to bring up something important, or air quotes, forgetting an appointment. Freud also believed in the importance of interpretations and explanations, where he would try to help the patient to gain a better understanding of his or her unconscious mind by interpreting things like dreams and comments that are made through free association, defense mechanisms, and that sort of thing, in order to shed light on the person's unconscious mind. Another of Freud's important contributions was to describe the process of transference. Do you know how that works? Yes, in transference, the patient projects onto the therapist conflicts, unacceptable feelings, unresolved issues that they may have towards some other significant person in their life, past or present, oftentimes an authority figure like a parent. Let's say, for example, that a patient was in therapy and they didn't have a very good relationship with their own father, and they couldn't really talk with their father about some important things that had happened in the past that they wished they could talk about so that they could get on a better footing. The person feels angry towards the father, but what happens in the therapy, since she can't express it to her own father, we'll say she's seeing a male therapist. Eventually, she starts getting angry with her therapist and projecting her anger that she has towards her own father onto her therapist. And that's what happens with transference. So the person is transferring feelings from one significant person in their life to their therapist, whom they regard as being a safe person, which increases the likelihood of that sort of thing happening. And the role of the psychoanalyst in that situation would be to analyze the transference and help the patient to deal more directly with those unresolved feelings towards somebody important in their life. So in psychoanalysis, when patients experience strong feelings for their analyst, this is called transference. Patients are said to demonstrate anxiety when they put up mental blocks around sensitive memories, showing resistance. The analyst will attempt to provide insight into the underlying anxiety by offering an interpretation of the mental blocks. The way psychoanalysis was originally practiced was to see the patient at least 3 times a week, sometimes for years. There are some people who are still traditionally trained and practice psychoanalysis in that way, but they're few and far between. Not a lot of people can afford that intensity of therapy. And a newer type of therapy based on psychoanalytic principles called psychodynamic therapy has been developed over recent years and has been found to be effective in the treatment of a variety of problems. Now, in the case of traditional psychoanalysis, the analyst would sit behind the head of the patient who is lying on the couch and free associating, and occasionally make a comment. In psychodynamic therapy, the therapist and the patient sit across from each other, just like in other kinds of therapy, and the therapist is more engaged in ongoing conversation with the patient. They also try to gain an understanding of the relationship between past and present and unconscious influences in the person's life, helping them to achieve insight. But the duration of the therapy and the frequency of the therapy tends to be less, maybe meeting once, at most twice a week for maybe 6 months or so. In psychodynamic therapy, the therapist helps the patient to come up with what's called a dynamic focus. And a dynamic focus is an area on which the two of them agree to focus on and explore in an effort to help the patient to get to a better place. For example, a dynamic focus might be having difficulty trusting people, exploring that, trying to understand the origins of that fear of trusting people, and to help the individual to address it so that they might eventually be able to invest in more in relationships where they can experience a higher level of trust. Here we see a client and her therapist engaging in psychodynamic psychotherapy, the modern version, where they're seated across from each other and having a conversation. A second type of psychological therapy is called humanistic therapy. And just like psychoanalysis is based on some of the ideas in Freud's psychoanalytic theory of personality, humanistic therapy is based on some of the ideas that Maslow and Rogers have about personality. An important focus of humanistic therapy is the self. We each have a self, a sense of self of who we are as a person. And humanistic therapists would say that we have an actual self and an ideal self. The closer our actual self and our ideal self are to each other, probably the happier we're going to be, the better adjusted we'll be. The greater the difference or discrepancy between the way we actually are and the way we would ideally like to be, the greater the likelihood of unhappiness and adjustment difficulties in life. So through humanistic therapy, the therapist tries to help the client to gain in self-understanding and also self-acceptance, and to take personal responsibility for their feelings and actions and for the choices that they make in life, so that they can hopefully learn to choose differently in order to get to a better place. Both humanistic and psychodynamic therapies are referred to as insight therapies because they strive to achieve insight, that is, self-understanding of the relationship between thoughts, feelings, and behaviors. But in humanistic therapy, the focus is much more on the conscious mind than the unconscious mind, and on the present and future, less so on the past being a major focus of psychodynamic therapy. Carl Rogers developed a type of humanistic therapy called person-centered or client-centered therapy. His therapy is referred to as being non-directive because in this type of therapy, the therapist strives to gain the trust of their client by treating them with respect and listening well to what they share, and helping the client to come to some decisions about the direction they would like to go with their therapy, with their life, and to work with them along that path instead of telling them what to do. If you tell somebody what to do and give them a lot of advice, that's more of a directive approach. But in a non-directive approach, you're more focused on listening, helping the person to make their own decisions, and then supporting them in the process of achieving the goals they come up with and making the decisions that they decide that they need to make in life, and helping them in that process and being a source of support for them. For Rogers, just like in talking about personality development, in the therapy, he also believed that the counselor or therapist needs to provide genuineness, acceptance, and empathy to their client in order to help them to grow and to get to a better place. Genuineness simply has to do with being yourself, being real. Acceptance has to do with that special kind of unconditional acceptance, no strings attached, that Roger says we need from others. He called it unconditional positive regard. And he said that therapists need to provide that to their clients. And empathy, which of course is our ability to put ourselves in another person's shoes, so to speak, and to feel what they are feeling and communicate our understanding of that feeling back to them, to have empathy for them. It's not necessary that we have gone through the exact same experience before in order to have empathy for the pain, for the suffering of another person. So when we're empathic, we're able to appreciate what the other person is feeling, what they're going through, and to communicate it effectively back to them. And like we were saying earlier, for Rogers, unconditional positive regard is an extremely important part of the therapy experience. The idea here is that when the therapist can provide the client with unconditional positive regard, which is total acceptance, genuineness, and empathy, it creates the environment where the client is able to grow and flourish and develop a healthier sense of self. Another thing we learn about in this chapter, and I love how the authors of our book included it, is some suggestions about how any of us in our friendships and other relationships can become better listeners, more effective communicators, more supportive of other people. And they describe this three-step process of reflecting feelings, summarizing what we're hearing somebody say, and inviting clarification to deepen our level of understanding of another person and to help them feel listened to and understood. Reflecting feelings is we use feeling words to reflect back to the person our understanding of what they might be feeling. Wow, that it sounds like that was really scary for you when that happened. Summarizing is taking different things that a person is saying and putting it into our own words and sharing it with them and seeing how well we're understanding. And it helps them to feel understood and valued, even if we don't get it exactly right. From what you're telling me, what I'm getting is that because you've had some bad experiences in relationships, it's really hard for you to trust now. You would like to be able to, but you're afraid to try. That would be an example of a summary. Inviting clarification would be to ask the person to elaborate, to say a little more, maybe to give an example. Would you mind giving an example of that to help me understand it better? You might want to try these ways of improving communication. Pay attention to when you're able to do these things in your relationships and see what effect it has on you, on the other person, and on your relationship with one another. This completes the first part of our discussion about therapy. I look forward to talking with you again soon. Peace be with you.